Hey guys, what's up? Today I'm going to reveal the mysteries of the SI joint. Okay, it's really not a mystery, you just got to know what to do for it. Coming up. Okay guys, so today I'm going to reveal the mysteries of the SI joint. One of the most frustrating things to me as a practitioner, as a clinician, is when people come in and they talk about having pain right here. This here is the sacral iliac joint. It's pretty much where the sacrum and the ilium meet, or the innominate, and it's pretty much the foundation to the entire spine. So the first area that should be protecting the SI joint is the gluteal muscle. So if you sit a lot, or if you have a muscle imbalance between your glute muscle and your hamstring, your first area that you're going to hinge at is the SI joint. Now there's a lot of treatments for the SI joint. You can manipulate the SI joint, so adjustments, spinal adjustments, and those help. They're temporary alleviators of the pain. But usually SI joint is mechanical pain, meaning you're doing something wrong to bring it back on. Now, the other thing about the SI joint is that it's the foundation, or the sacrum and the pelvic girdle is the foundation to the entire torso. So if you're moving incorrectly, either walking or running or climbing upstairs, eventually that SI joint is going to get irritated. Now, the prevalence of SI joint irritation is higher in women than it is in men. And as we get older, the SI joint tends to fibrose, so it won't have as much movement as before, but there is some movement in there because it is a joint. Anyhow, so today, what you want to do, or what I'm going to teach you how to do, is how to stabilize the gluteus maximus muscle, or all the gluteal muscles, all the hip extensors. That way you start taking pressure off the SI joint. Okay, pretty easy movement. If you want to do the exercise to eliminate the pain, that's probably my recommendation versus getting a bunch of manipulation, SI joint injections. There's even something new that's come out where they're fusing the SI joint. Now I'm sure there's instances where the SI joint needs to be fused, but if it can be avoided at all costs, then I would do so, right? So next I'm going to show you how to do that exercise with our model Eden. Okay, so this is Eden from behind. The SI joint is actually located right here, right? So if you have pain right here on this area, that's SI joint irritation, okay? Now, is it possible to have it on both sides? Yes, you can have SI joint irritation on both sides, and the pain will actually feel like a line straight across the waist, okay? Now, what you want to do for that, go ahead and turn around, wave to the camera. Okay, so this is Eden from the front. So what we want to do, right, she's got nice posture, she's nice and upright. She works out, she's a runner, so exercises a lot. Turn around. Okay, so what we want to do is we want to engage the hip right in there. So that's our target area. This is where you want to feel the burn. That's what you want to work out. Okay, so the movement we're going to do today is going to be a single leg deadlift kettlebell. A single leg deadlift kettlebell lift. Okay, so what we're going to do is I'm going to have her bend and hinge at the hip. Okay, try to maintain the knee as still as possible, right? You don't want to bend at the knee. You want to go down, grab the weight, okay, and then you want to lift it up, set the foot down, regain your balance. If you're good enough to keep the foot up, that's perfect, okay? Then do it that way. A little more challenging, just like that, okay? You're gonna lose your balance. It's not easy, okay? But it's making the hip work, and it makes the hip fire, 100% firing, okay? Here we go. So good. She executed that perfectly. Now go ahead and go back down. She's not touching the floor, so she's showing off a little bit. Now this is also going to engage the obliques, the abdominals. Go ahead and do the other side for me. What you want to do is you want to look almost like a tabletop. So you want to try and get that as flat as possible. And that's all glute work right there. And then right back down. Okay. You want to do about 10 of them per leg. And you're done. Now, what do you do after you're done? Turn around for me. When you're done, you should be tired in this area and this area. What you do is you feed into that fatigue, right? And you want to use that to stand. Now, when you use that area to stand, where did you feel it, Eden, when you did those movements? Okay, so what I want you to do is I want you to distribute your weight through that area. See what she did? You may have to do that, edit that way you show that shift. But what she did was she put her weight right through her hips. And what that does, it takes the pressure off the SI joint. That's it for today's video. I'm Dr. G. Thanks for watching. Don't forget to click like and subscribe. If you've missed any of our previous content, it's located right here on the top right-hand corner. See you next time.